the news that Angelina Jolie has undergone a double mastectomy, not because she has breast cancer, but in order to prevent it.
And here to tell us more about the procedure and the road ahead is Dr. Glenn Brooks from Aesthetic Plastics and Reconstructive Surgery in Longmeadow. Thank you so much for taking the time to join us.
Thank you for being here.
Now, we've heard the news, we've heard so much about it, but I think a lot of people out there, ourselves included, we don't know what it actually means. So if you wouldn't mind, just kind of describe maybe the path that you can infer that Angelina might have went on.
Well, from what I heard through the news, and that's where I'm getting it from also, is Angelina's mother had breast cancer and died at an early age. And because of that, Angelina got tested for the breast cancer gene. And from what I read in the reports, she was BRCA1 positive, which is the BRCA test or the breast cancer gene test. And because of that, she decided to proceed with double mastectomies.
So for women who have who want to take this test, is it the best idea to take it if you have people that have gone before you that have had it, like Angelina did?
I'm not sure I understand what you're saying, but I think if patients have a strong family history of breast cancer,
yes,
they have a mother or grandmother with breast cancer, that's a good indication that they ought to be talking to their doctor and finding out whether they're a candidate to test for the gene and find out whether they're genetically predisposed to get breast cancer.
Now, once people get that test, the results come back if they're predisposed to having it down the road or not. And then from there, the route oftentimes is a mastectomy, which is the removal of some of the breast tissue. Is that correct?
Well, actually, the patient should get advice from their doctor because not everybody should have a prophylactic mastectomy in order to avoid getting cancer in the breast. And some people could certainly be watched very carefully over time with serial exams, serial mammograms or MRIs, and not necessarily get the surgery. That's a choice the patient makes with their doctor. But certainly, bilateral mastectomies prophylactically to avoid getting the cancer is one choice.
So it's one road that one could take if they thought that they were going towards breast cancer in their lifetime.
Correct.
Now let's talk going forward. Angelina or whomever can elect to have this elective surgery, and then the process, that's kind of where you come in. It's the reconstruction and what's available to people after they have their mastectomy.
Right. Well, you know, most of the time now we're doing it at the same time as a mastectomy, and that's a shift. I started in practice over 20 years ago. When I started, we were doing most of those reconstructions in a delayed fashion, months or years after the mastectomies. And now we're doing it more in an immediate fashion. And we've shifted from doing more reconstructions using patients' own tissue, which we still do sometimes, to using expander implant-based reconstructions. So it's a bit simpler for patients, and it's also more simple for those patients who are having prophylactic mastectomies to have both sides done at the same time.
Now, Dr. Brooks, right now we were looking at an actual breast, a silicone breast you use. That's somewhat of new technology. If you wouldn't mind telling us a little bit about that.
Well, you know, one of the things that's happened is we've come a long way with implants themselves. In 1992, silicone implants went off the market. They came back in 2006 because of really good science showing that they are really safe. And what's happened in the last year or two is shaped implants have come back, and that's what we have here is a shaped implant versus a round implant. So it matches the teardrop shape of a natural breast and gives a much better reconstruction.
So even if you opt for this surgery, you can still feel like a woman with this new technology that you have.
Right, and certainly going forward, what we've done is we've changed, the mastectomy surgeons have also changed what they do. Instead of taking out significant amounts of skin, they're taking out less and less skin, perhaps leaving the nipple and the reel on the patient's breast, or taking out just a small amount of skin and saving the shape of the breast. We just have to fill it with an implant, so it looks actually very close to what they had, or they can adjust size if they wanted to.
Now, generally, what's the rehabilitation time from a surgery like this? And now it must be even a little bit shorter, that you can do both the augmentation surgery and the mastectomy in one.
Well, and that's one of the things that makes using tissue expander and implant-based reconstruction more popular these days, is that the recovery is that much shorter. Many patients are back to work certainly within 3 or 4 weeks, and many patients doing most things within 2 weeks after surgery. We usually keep them in the hospital overnight, one night for the first operation, and the rest are usually day stays, in and out the same day.
So it's something that can be done. It's healthy, it's safe, and it's definitely worth looking at, because a lot of people out there, they have family histories, so it's definitely worth, you know, taking that chance, talking to your doctor, and seeing if you might qualify.
Knowing that those things are available to them.
Exactly. Well, Dr. Brooks, thank you so much for stopping by
Thank you for having me.
really shedding some light on something like this. Coming up.